Hello there. Thank you for clicking on our poster. In this work, we provide a clinical analysis of the effect of respiratory variability on respiratory signals that are extracted using data-driven methods in different fractions of CBCT imaging. As an introduction, it is known that irregular breathing patterns during respiration could compromise the quality of the reconstructed CBCT images, especially since they could occur within a patient involuntarily. Reconstructed 4D images that are dependent on the quality of projection binning are susceptible to the accuracy of an estimated respiratory signal. Therefore, we present an extended analysis from a previous work that involves comparison between four basic data-driven methods in estimating respiratory signals, where, in this work, the analysis involves estimation of respiratory signals from 6 different treatment fractions of a lung cancer patient. To achieve the said objective, first, reference signals are extracted manually from the acquired 2D projection images of each fraction by eyeballing the apex of the moving diaphragm throughout the images. Based on the reference signals, pattern irregularities are characterized by the epoch of apnea-like features that represent moments in which the patient is in a state where its breath is held. Then, the four basic respiratory signal estimation methods: one, Amsterdam Sharp, local principal component analysis, intensity analysis, and the fourth one is Fourier transform phase methods, are used to estimate the respiratory signals directly from the acquired clinical projection images. Finally, the quality of the estimated signals from all the four methods are assessed by evaluating its local correlation against the extracted respiratory signal earlier. The local correlation is achieved via sliding a window of an assumed length of 12 respirations per minute throughout the signal. Shown in the slide are the classifications of different interfraction variability based on the percentage epoch of apnea-like features, where three types of variability: regular, moderate, and severe patterns are classified. The LPCA method performed with the highest correlation value for F2 at 0.908 individually. However, its mean correlation throughout the entire expression is only 0.744, second to the AS method at 0.778. This is an early indication that even though the LPCA method is able to extract the respiratory signal from a regular breathing pattern, which is in F2 fraction 2, with higher accuracy, it does not necessarily suggest its robustness for irregular patterns as well. For the breathing signal with severe irregularities within this set of data, such as in fraction 4, where the apnea-like features that indicate temporary cessation or breath holding covers 33.7% of the entire 60-second CBCT acquisition period, the LPCA method performed with a low correlation at 0.554, which is only slightly better than the intensity analysis method at 0.538. These low correlations were, in fact, the LPCA performed poorly even among the normal breathing traces that followed after the apnea between the OBI angles as shown in the slide. This is also observable in the apnea-like features of fractions 3 and 5, corresponding to the moderate and severe irregularities respectively. For fractions 4 and 5 with severe irregularities, the AS and FTP methods fared better with higher correlation values compared to LPCA and IA. Both can be seen to preserve the apnea-like features after the apnea epoch, with FTP being slightly better compared to the Amsterdam Sharp method. This is probably due to the higher reliance of the AS method on the best bandpass filter vis-a-vis to the FTP method, since the latter, although includes a similar bandpass filter, but the magnitude of the projection views are preserved during the Fourier transform step in its algorithm. As a conclusion, characterized by the epoch percentage of the apnea-like features, the presented interfraction clinical dataset demonstrated irregular and regular breathing patterns variability of the same patient. From the results, it is found that irregular breathing patterns affect the quality of the estimated signals using data-driven methods, with the AS method is evaluated to be more robust across all the datasets compared to the other methods.